So today we'll continue with medical nutrition therapy, starting with diabetes mellitus, page number 453. Page number 453. If anyone is joining late, please help them out with the page numbers. So diabetes mellitus, as we have discussed in many of our previous classes, even in dietetics and even in the Wednesday classes, we have discussed in detail about diabetes mellitus. Okay, you can check those videos also. Here we'll just brief through it. So type 1 and type 2 diabetes. Okay, apart from that, we have gestational diabetes in women as well. Okay, insulin resistance, gestational diabetes, type 1 diabetes, type 2 diabetes. So these are the classifications of diabetes. Okay, type 1 is common among children. That is also called as juvenile diabetes. Okay, where the pancreas are not able to produce insulin at all. Okay, because of autoimmune deficiencies and all. Okay, next is type 2 diabetes. It is rare, but it is increasing with the obesity pandemic. Okay, obesity pandemic from a Western point of view. Okay, from an Indian point of view, you don't have to be overweight or obese to have diabetes. Okay, if you store a lot of fat in your abdominal region, okay, if your hip to waist ratio is higher than 1, okay, so that means that you have a higher chance of developing diabetes mellitus. Okay, that is type 2 diabetes. Then you have syndrome X, also called as insulinism, hyperinsulinemia as well. Okay, insulin resistance in general, because the pancreas are producing a lot of insulin to make sure that the blood glucose levels can be controlled. Actually, your cells are not taking the glucose in, so more and more insulin is being secreted by the pancreas to push the glucose into the cells. Okay, but it is not working. Okay, so your blood goes into a state of hyperinsulinemia. Okay, or hyperinsulinism. So too much of insulin in your blood is called syndrome X. Insulin resistance is also a symptom that comes under syndrome X. And this is more common with central obesity. Central obesity means you store a lot of abdominal fat. Okay. And in children, when they get the type 1 diabetes, after initial screening, okay, insulin requirement is insulin, the child will be put on insulin. Okay. And the symptoms can come down to more than 50%. Okay, and then later slowly the insulin requirement will increase when the child grows and develops. Okay, so the child has to be put on a very strict diet. It is called diet D. Okay, it represents disciplined diet. People think that diet D stands for diabetes, but it is more like a disciplined diet. Okay, they have to maintain adequate amount of carbohydrates, fat, and protein ratio. 50% energy should come from carbohydrate, 20% from protein, 30% from fat. They have to avoid fasting and feasting both. Okay, long durations of staying away from food is not possible for them, and even feasting, overeating is also should be avoided. High fiber diet, low fat diet with complex carbohydrates, adequate carbohydrates and protein is what a disciplined diet stands for. Okay, it is in general good for everyone, not just diabetes patient. For everyone, disciplined diet is good, but it will benefit the diabetic patients more. Okay. Coming to meal planning. So meal planning with a diabetes client is it ensures that their blood sugar levels stays normal. You have to control the blood sugar level in a diagnosed diabetic person. Okay, and meal times, it should be regular. The quantity should be consistent. It's not that Monday you had a lot of food, Tuesday you had less. Okay, just because on Monday you feasted a lot, Tuesday you have to eat less. You can't do this with a diabetic person. Okay, so you have to be very consistent, very regular with your meals. Okay, sodium restriction should also be looked forward for, because usually diabetic people, they are at a risk of developing cardiovascular diseases as well, more or less sooner. Okay, sooner or later they will go into a series of cardiovascular disease, starting with hypertension. So it's better to put them on a salt restricted diet before the symptoms get worse. Cholesterol also should be restricted, and low energy but nutrient rich food is given, that is complex carbohydrates. So these are the principles of meal planning. When it comes to carbohydrate, you have to avoid monosaccharides and disaccharides. Okay, anything that has a lot of fructose, glucose, and sucrose. Okay, these are monosaccharides. And disaccharides, okay, they get easily absorbed. As soon as they reach into the intestine, they are absorbed. They get absorbed into the bloodstream. So you have to focus more on complex carbohydrates, ones that are very difficult to break down. Okay, so in insulin, when it is injected from outside, okay, it's usually, there is a timing for that. What kind of insulin you are using, short acting, long acting. Okay, it's usually prescribed by the physician based on the stage of diabetes they are. Okay, so long acting insulin, maybe once a day you have to take, and it works for a longer time. For 2-3 meals, it can cover you. Okay, short acting insulin, every time you are going to have a meal, you require your insulin shot. Okay, so those are the uses of insulin, and not every diabetic will require insulin. Okay, with metformin itself, initial stages of diabetes can be controlled. So coming to carbohydrate, avoid monosaccharides, disaccharides, refined sugar. Okay, for example, sucrose, sugar, honey, white sugar, table sugar, honey, sweet drinks. Okay, and eat more complex carbohydrates like whole wheat. Okay, ragi, unripe banana, jackfruit. They all have low glycemic index and low glycemic load. Resistant starches are good for diabetic patients. Okay. Next, coming to fiber. So fiber is basically a polysaccharide. Okay, you have monosaccharide, disaccharide, complex carbohydrates, polysaccharides. So polysaccharides are like a plant cell wall. It's part of the plant cell structure. Okay, which is very difficult to break down. So it delays absorption. Things that are difficult to break down takes time in absorption. Okay. So because of delay in absorption, it leads to hypoglycemia. It will not shoot your blood sugar level immediately up. Okay. And also certain fibers like pectin, gum, etc. Okay, they can help the bile salts bind with them and increase their excretion. Okay, so it improves your gastric motility as well. Okay, that's the use of fiber. It helps with your cholesterol. Okay, it prevents constipation. Examples are having whole wheat, whole grains, coriander, okay, carrot, brinjal, cauliflower, ladyfinger, that is okra, raw mango. Okay, they all contain good sources of fiber. Ripe fruits have, like, see, well ripe fruits have low fiber as compared to their slightly unripe version. Okay, coming to fat. Low fat, it increases insulin binding in your cells. Okay, having a low fat diet, it reduces the LDL, that is bad cholesterol. Okay, it also reduces triglycerides. So therefore, it reduces the risk of developing atherosclerosis later in life. Okay, diabetic people are also at the risk of developing atherosclerosis. That is, cholesterol getting it creates blockages in your arteries, fats creating blockages in your artery. That is atherosclerosis. Then polyunsaturated fatty acids can help here. It's usually recommended. All your vegetable oils, vegetable fat, they are good sources of polyunsaturated fatty acid. And avoid animal fat like butter, ghee, hydrogenated oil like dalda, vanaspati and all. Fish and chicken is more preferred as compared to red meat and egg to prevent cholesterol. Consume more turmeric in your diet, Bengal gram, okay, onion, garlic. They can also reduce your cholesterol levels. They are known to reduce your cholesterol levels. Then fruits, there are specific group of fruits that the diabetic people should avoid. Fruits that have low glycemic index are good. For example, what this muskmelon, okay, cantaloupes, muskmelon, guava, apples, okay, pears. These are the fruits which are ideal for diabetic persons. Green bananas, okay. So that's about meal planning. Model diet, they have given you to 2000 calories per day diet example for a person who is diabetic. Okay. Um, they have given North Indian as well as South Indian mixed menu here. Okay. They have given you options also on page number 456, table 34.18, a model diet for child with diabetes. Okay, 2000 kilocalories is the target here. Carbohydrate given in this menu is 50 to 60%. Protein will give 10 to 15% energy. Fats will give 20 to 30%. Okay, you have to plan 3 major meals and 3 snacks because short and frequent meals, that is very ideal for diabetic patients. Okay, so you can make your own diet chart from here as well. You can for different calorie target given here is 2000 kilocalories, but based on your client's requirements you can reduce or add more calories, but the recipes are given, the contents of the menu chart is given. Okay, so you can use it for future use. So coming to exchange system, this is food exchange system. If you check your dietetics textbook, you in the chapter of menu planning, you will find a protein exchange chart. Here they have given you a carbohydrate exchange chart. What is food exchange or carbohydrate exchange or protein exchange? Okay, what we are trying to get from this information is that different recipes but same number of carbohydrates. Okay, for example, in the table given on page 457, table 34.19, okay, one exchange is equals to 10 gram of carbohydrate. Okay, so here they have given one exchanges. So if you have half a slice of bread one day, the next day if you're having two cream crackers, on third day you are having unsweetened orange juice, 2/3 cup of it. Okay, on fourth day if you're having apple or orange, or what's happening is that every day you are not eating the same food, you are using different kinds of food so that you are avoiding monotony. Okay, so you're avoiding monotony by including more and more options in your diet, but it's not interfering with your carbohydrate requirement. Your carbohydrate is the same. Okay, the portion size and the option varies day by day. Okay, so that is what a carbohydrate exchange is. It's make sure that on a daily basis you have something different to it, but it is giving you, ultimately it is giving you the same number of macros, more or less the same amount quantity of macros are going in. Okay, so that is exchange system. Then glycemic index and glycemic loads. In detail, we have done classes on this. Glycemic index is a ranking system, okay, that never changes. Glycemic index is like according to one to above 70, below 70, above 55, below 55. So there is a ranking system. Every food has a rank. Okay, that is a glycemic index. But we do not know how much has to be eaten. Okay, so that idea glycemic load will give you. Okay, if you have just one piece of watermelon and a whole cup of watermelon, okay, the way how you the calories are going to affect you, the amount of carbohydrates are going to affect you is completely different. Okay, but the glycemic index is same for one piece of watermelon and one cup of watermelon. The both are watermelon means the glycemic index is same, but the glycemic load is different because here we are looking for the quantity as well. That is glycemic load. Okay, so low glycemic index and low glycemic load food are the ones we prefer here. Okay. So glycemic index is just a relative ranking of carbohydrates in food. It shows how food affects the blood glucose level, different food, how it affects the blood glucose level. Diets which have low glycemic index are associated with lower risk of chronic diseases like diabetes. So high glycemic index food, they have monosaccharides, disaccharides high in higher quantity. Okay. It will also lead to excessive weight gain, overeating, excessive hunger, because if something is getting easily absorbed in your blood, okay, you will feel empty, your stomach will be emptied soon, so you will feel hungry again and again. Then low glycemic index, foods that have low glycemic index are digested, absorbed, and metabolized very slowly. So that definitely they will increase your blood glucose level also at a very slow pace. They will not put on weight on you. Okay, they can help in weight management. It also reduces the risk of developing type 2 diabetes, cardiovascular diseases, cholesterol issues. Okay, that will be reduced with low glycemic index food. So examples of high, moderate, and low glycemic index foods are given in the same page on page number 458. You can check that. Then coming to glycemic load, as I mentioned earlier, it's the product of the glycemic index of the total available carbohydrate in the food, keeping in mind how much of the quantity have you eaten. Okay, glycemic load of a particular food, if you want to calculate, you should also know how much is the quantity given as well. Okay, glycemic index will be used here in this formula definitely because it never changes. Okay, but how much amount of food you ate, that matters. Okay, how much grams of food you ate, that matters, divided by 100. So that's how you will get the glycemic load. And if the glycemic load is again, it has mild, moderate, and severe. Okay, any glycemic load of the food that is less than 10 is desirable. Okay, and glycemic load, if it is more than 20, it is not acceptable for diabetic patients. So portion size, to control the portion size, glycemic load is very important. Glycemic response, this is after having food. Okay, after having certain food, after eating food, how does your blood sugar level react? Okay, is it immediately spiking up and staying up, or is it coming down, or is it taking long time to come down, or is it taking a long time to go up? Okay, the glucose spike. So that is the glycemic response. And with glycemic load, if you just know the glycemic load of a food, it is very easy for you to predict the glycemic response of the foods. Fats and fiber can also slow down your glycemic response. No, glycemic load is not proportional to the weight. Glycemic load is like, for example, if I give you 100 gram of rice, boiled rice, and 200 gram of boiled rice, definitely the glycemic load will be different. Glycemic index of rice would be the same because it is a ranking system. We have ranked all the food and we have the information of that. Okay, glycemic index of rice, we know that. Okay, but are you having 100 grams of boiled rice or are you having 200 grams of boiled rice? That also makes a difference, right? Because the carbohydrate load is high. Okay, when you eat more rice, you are giving your body more carbohydrates, more blood glucose level spike. Okay, so to find out that, glycemic load is used. Okay, it's a much more accurate way of understanding how uh, a particular meal, not just food, how a particular meal, the portion size that you have chosen for yourself, is it good or not? Okay. Next is exercise. Exercise will also reduce the insulin requirement, which means what? After you eat something, this is for everyone. If you're diabetic, non-diabetic, doesn't matter, especially if you're a woman, okay? And if you have some PCODs, PCOS, some uh, ovarian syndromes, or some thyroid issues also, okay? What's happening here is you are eating food, your blood is getting the glucose, but your blood is not able to deposit glucose into the cells. Cells are not responding to glucose. Cells are not responding to insulin, so they will not open their doors for glucose to come in. Okay. So what happens is that you have after as soon as you eat something, eat a meal, okay, not snacks or even when you have your main meals on a daily basis, like lunch, dinner, or breakfast. Soon after eating, walk for 10 to 15 minutes, okay, or 20 minutes. Just walk around. Don't go and sit somewhere. Walk around for 10 to 15 minutes or 20 minutes. Okay, what's happening is your cells will get the idea that the body is working out. We need more glucose. Okay, cells, even without insulin, cells will open up their doors, waiting for the glucose to come in. And glucose can come in even without the use of insulin. So your pancreas don't have to be overworked to produce more insulin and release more insulin. With less amount of insulin, your body is able to work with the glucose that you have given through your meal. Okay, so that is the importance of exercise. It also avoids obesity. It increases the good cholesterol in your body, reduces the bad cholesterol. When you are moving, bad cholesterol, your blood circulation is high. Okay, the blood circulation is increased. Your cardiac output is also increased when you keep moving. Okay, so because of this increase in the blood circulation, increase in the cardiac output, because of that force, okay, low density lipids or cholesterol does not have time to sit back and get stuck to your blood vessels. They also keep moving and they get out of your system wherever it is not required. Okay, so that's how it reduces cholesterol. Insulin, as I mentioned earlier, when a person is put on insulin therapy, there are different types of insulin: short acting, long acting, okay, or the combination of both. And people who are on insulin, HbA1c test has to be done very frequently. Once in 3 months, you have to get your HbA1c test done, because the report of the average of what's happening in your system in the past 3 months, okay, that average is there in the HbA1c test. Regular insulin is given 30 minutes before meal. Diabetics who are taking insulin, 30 minutes before, half an hour before meal, they have to take their insulin, which is usually difficult to practice. So we have short acting analogs insulin, okay, which can be given soon before the meal, okay, just before you sit for your lunch, 2-3 minutes before it, you can take the short acting insulin and then eat food. Okay, this is also called as fast acting insulin. which can be given along with meal. When the person is having their meal, they can take their insulin. So insulin dose adjustment is depends on the insulin sensitivity factor. Okay, that's a test done. Okay, so based on whatever a person's insulin sensitivity is, ISF test is, okay, the doctors will decide how much should be the dose for them. Dose usually changes. Okay, every month you have to visit the endocrinologist or your diabetologist. Okay, and adjust your dose based on your based on how the body is performing. Then sweeteners, artificial sweeteners or non-nutritive sweeteners are available like saccharins, aspartame, sucramate, asulfame. Okay, aspartame is like being banned now because its association to certain forms of cancers. Okay, but other forms of artificial sweeteners are still being used. But we have to be careful with artificial sweeteners because they are also addictive in nature. Okay, like just like sugars, artificial sweeteners are also addictive in nature. So you should not be dependent on them. Okay, you have to control the diabetic have to control their urge for having something sweet. Okay, it could be sugars based on sugar based sweet or artificial sweetener used sweet, does not matter. But they should have the urge to control their sweet intake. Okay, that is the only solution for this. Next topic is hyperlipidemias or dyslipidemia. Hyperlipidemia, too much of lipids in the bloodstream. Okay, it is a family, it's a genetic condition as well, and that is primary one. Secondary is based on your lifestyle you may get. Okay, and people who have hyperlipidemia, they have a very high risk of developing any form of heart diseases. Okay, and adult cardiovascular diseases, most of them, they have their roots in childhood and adolescence. High intake of cholesterol laden food, triglyceride laden food, okay, which circulate as lipoproteins in your system. Okay, they are responsible for leading to cardiovascular diseases. Low density and very low density lipoproteins, okay, they are produced by the liver, and they are also called as bad cholesterol. These are the ones responsible for causing hyperlipidemias. So under that, you have primary hyperlipidemia, as mentioned earlier, based on your genetics. Okay, if your family member is suffering from that, usually the next generation will also suffer from the same dyslipidemia. It's a genetic defect. The secondary hyperlipidemia is based on your lifestyle. Okay, if you are obese, you suffer from hypothyroidism, which affects your metabolism, nephrotic syndrome, glycogen storage disease, lipid storage disease, diabetes mellitus, any liver disorders, gallbladder stones, hepatitis, anorexia. Okay, if these are the diseases that you are suffering from or were chronically suffering from, there are high chances you will develop secondary hyperlipidemia. Then screening, blood test is done, and if your serum cholesterol is between 170 to 200, it is considered as a estimate. And if the average of the serum cholesterol is more than 170 mg per deciliter, you have to do the lipid profile to understand which particular cholesterol is high. Okay. Triglycerides should be less than 160. High density lipids should be should be more than 50. Low density lipids should be less than 110 mg per deciliter. So this is the acceptable ranges. So doing a blood test will give you your lipid profile. So dietary management, there are different forms of dietary approaches here. Usually, even if one person in your family is been diagnosed with hyperlipidemia, the entire family should switch their diet. That is the ideal way to prevent even more diagnosis within the family. Okay. So step one diet is when your low density cholesterol is more than 110 mg per deciliter. Okay. 30% of the calories only should come from fat. Okay. You have to be very strict with that. And that includes monosaturated, polysaturated fat. Okay. Restrict your cholesterol. One egg per day is fine, but not more than that. Avoid the yellows of the egg. Just eat the whites of the egg. In step two diet, when the low density uh, lipids, cholesterol is more than 130, then you have to start with step two diet. Okay. So only less than 7% of the calories should come from fat. Less than 7% of the calories should come from fat. Okay. So restrict cholesterol to 200 mg per day. So to 66 mg per 1,000 kilocalories. Okay. So skimmed milk powder should be used instead of ordinary milk. Okay. Skimmed milk powder alone can give you essential fatty acids. Okay. It can give you essential fatty acid deficiency. So you have to take your essential fatty acid supplement also. MCT oil can be given. MCT oils are available in the market that can be given. That is medium chain triglycerides. Okay. Cholesterol content in the food, animal food. It's better if they switch into a plant-based diet. It's good. High fiber diet, antioxidants like vitamin C, beta carotene, vitamin E. Okay, they all have to be taken because they will protect your heart against any inflammatory damage. Green tea is also good. Encourage more fruits, vegetables, fish oils, mushrooms as well. Which are completely fat free, and avoid dalda, margarine, mayonnaise. Okay, these things has to be avoided. Then Pritikin approach, that is diet and exercise. So this was introduced by Nathan Pritikin in 1974. It's a live longer approach. So it helps for people who have coronary artery diseases, hypertension, or non-insulin dependent diabetes, etc. Okay, to help them out. So Pritikin, there are two types of Pritikin approach, type 1 and type 2. So in type 1, only 10% of the calories should come from fat, 10 to 15 can come from protein, and more than 80% can come from carbohydrates. Okay, it's a high carbohydrate diet, very low fat diet, and medium protein diet. 30 to 40 gram of dietary fiber should be included per 1000 kg. Sodium restriction is done. Salt restriction is done. Whole grains, beans, pea, vegetables, fresh fruits, non-fat meat, that is uh, poultry meat with boneless chicken and all. No non-fat fishes, low-fat fishes, no-fat cheese, etc. are allowed. Meat, you have to restrict it, just one portion per week. Then Pritikin therapeutic diet part 2. In addition to above all the mentioned vegetables we have discussed right now, on top of that, alcohol should be completely restricted. Cholesterol based Animal products will be completely restricted. Usually they will go into a vegan diet or a plant-based diet. Just give me 1 minute. Then we have the drug therapy. In drug therapy, we will not discuss in detail. Okay. These drugs used are usually to suppress the uh, diet, okay, to control cholesterol. These are the targeted drugs used. So this is the clinical management. We will not discuss that. You can read it later. Fish oils are also used to compensate for essential fatty acids.